Okay, so this week we're going to be looking at developing technology in dentistry. So we're going to start off with artificial intelligence, and this is usually used by dentists, and they can use artificial intelligence to detect early stage dental caries and root fractures. So sometimes dentists can miss out the early warning signs of these things, and AI just is in place to ensure that that gets prevented. So that means that there's less work done in the future on the patient, so it's more convenient for them as well, and there's less cost involved. So, for example, periodontitis, which is gum disease, that's quite hard to spot early, so it makes it easier if AI is involved, because that means that the dentist can treat it early on. And also, AI can curate an ideal orthodontic treatment plan. So, at a work experience that I did, the dentist was showing me that the patient's teeth were scanned onto a software, and that software projected the timeline of how their teeth would progress and how they would align to become straight. And it also can detect cancer early on. So so the dentist can see how you can treat it. You can target your treatment in that specific area to prevent the growth of that cancer. And you can also generate perfect dental crowns through CAD. So a dental crown, usually the dentist would take a mold of your teeth, and then that would take quite a while, and it would be quite labor intensive to make a dental crown. So using CAD, which is computer aided design, that's used, and that can be it can make a perfect dental crown that fits onto your teeth without any. There could be minor adjustments involved, but on the most part, it's usually perfect. Next is a smart toothbrush. So this smart toothbrush is called the Colibri toothbrush, and what it does is it's connected through an app. So this app tells you your brushing habits, or if you're brushing the correct way, how to change your brushing to get the most effective clean. And it has an interactive game for children which they can use with their toothbrush, and that helps them to build habits and clean their teeth well. And another example is the Sonicare smart toothbrush, and that has sensors in the handle, and it gives you real-time feedback to tell you if you're applying, say, too much pressure, or if you're not brushing in the correct place. That also has an app. But the downside to this is that there is obviously data protection concerns, because all your data is in the app. So companies may sell it to third parties. And also, it's important to remember that dental professionals always give the best advice on your brushing. So it's better to go to a dental hygienist, which will help you with your brushing. The next is augmented reality. So this is usually used for students, and it's more of like a dental simulator. So they do treatment on patients, or it can be on models as well, whilst practicing, and it helps their learning. So they usually gives tips whilst you're treating the patient, and helps the student learn and develop their skills. So this is more prevalent in reconstructive and aesthetic procedures, obviously, because the dental student would need to see what's going on. Next is virtual reality. So this is beneficial for both the dentist and the patient. And for patients specifically, they can put a headset on, and that would probably put them into a more calming or relaxing environment depending on where they want to go. And that would mean that any fears that they may have associated with the operatory, that wouldn't be present, and they're just more relaxed and calm and have more happier memories after the procedure's done. And also, this is quite helpful for dental students in the sense that they can be somewhere else, and they can see through the headset a live surgery or procedure taking place from the dentist's point of view. So that more helps with reducing crowding or unnecessary stress to the dentist and the patient both whilst the procedure is going on. Next is teledentistry, which is sort of like a live call with your dentist. So this is usually used for the elderly, or maybe parents with young children, or if you're far away from a dental surgery, and if you don't have access to these things, you can always call a dentist, book an appointment with the dentist, call them, and so over here they're showing them their teeth. So any verbal feedback that they can give And if there is a more serious problem, the dentist can always call them to the dental office and they can help them that way as well. Next is CAD in 3D design. So 3D printing, as I said before, it helps with the accuracy and precision of any, say, dental crowns or any fittings that need to go into your mouth. And it's less time consuming and less labor intensive. So any specialists that you would need to make these fittings that go inside your mouth, those specialists can be used in other areas as well. So you have more time, so more fittings can be created, and it's quite precise. So that means that less manual work will be needed after any like crowns or anything are made. And it also reduces error, which of course reduces cost. Next is the intraoral camera, which eliminates the need for a dental mirror. So dental mirrors, if you've been to a dentist recently, you'll find that it's quite inconvenient for the dentist to have your mouth wide open and then look at your teeth through that mirror. And this over there, the intraoral camera, it prevents this inconvenience. So the dentist can look through a screen and they can see any, say, if they have dental cavities, anything. And they can also capture images for their own future reference and to show the patient what is exactly wrong. And regenerative dentistry, which is more for, say, so the example given is that the elderly, you come across teeth falling out. So with that, or like cavities that progress into obviously having a root canal or something like that. And so researchers at Nottingham University and Harvard University have looked into using stem cells, which are used as fillings, and they can promote the growth of dentin, which is the main component of your teeth, and that allows the regrowth of them. So instead of having to pull that tooth out, you can grow your own teeth back. And yeah, so it eliminates need for root canals, and obviously that means that more time is saved and less work is needed on this patient. So the last topic is CRISPR, which is clustered regularly interspaced short palindromic repeats. And this is used in mainly to eliminate cancer. So in oral cancer, so researchers in China have done some research on oral cancer, and what they've done is they've used this technology to switch off the oral cancer associated genes to prevent the growth of cancer, or to prevent like the start of cancer. And also other research has been done, and this involves altering the function of bacteria which form plaque, which means that you would have less decay done on your teeth, so less need for fillings, caries, anything. And of course it can prevent periodontal disease as well. And yeah. So those are the main 9 technologies which are developing in dentistry, and thank you for listening.